In the vast world of antibiotics, each with its specific targets and mechanisms of action, Cefixime holds a unique place. As a third-generation cephalosporin antibiotic, it boasts an enhanced spectrum of activity against a wide array of bacteria, some of which have developed resistance to earlier antibiotics. Our journey into understanding Cefixime begins with its discovery and development, a testament to the ongoing battle against bacterial infections. This antibiotic has been tailored to combat a variety of conditions, making it a crucial tool in our medical arsenal. The significance of Cefixime in modern medicine cannot be overstated. With bacterial infections becoming increasingly resistant to traditional antibiotics, the development of third-generation cephalosporins like Cefixime represents a critical advance in our capability to treat infections effectively. Its role in treating infections in both adults and children highlights its versatility and importance. Diving deeper into the specifics of Cefixime, we uncover its chemical composition and mechanism of action. This antibiotic works by disrupting the bacterial cell wall synthesis, a vital process for bacterial growth and reproduction. By targeting this essential function, Cefixime effectively halts the spread of infection, providing a powerful means of combating bacterial diseases. This introduction sets the stage for a comprehensive exploration of Cefixime, including its uses, benefits, potential side effects, and much more. Typical uses of Cefixime. Cefixime has been a cornerstone in the treatment of bacterial infections, particularly those that are resistant to other antibiotics. Its utility spans various infections, making it a versatile option for clinicians. The primary use of Cefixime involves respiratory tract infections, such as pneumonia, bronchitis, and tonsillitis, where its efficacy in eradicating bacterial pathogens has been well documented. These conditions, often caused by Streptococcus pneumoniae and Haemophilus influenza, find a formidable opponent in Cefixime. Beyond respiratory infections, Cefixime plays a pivotal role in treating urinary tract infections, UTIs, and gonorrhea. The ability of Cefixime to combat Neisseria gonorrhoeae, the bacteria responsible for gonorrhea, underscores its importance in addressing sexually transmitted infections, STIs. Moreover, its effectiveness in treating UTIs caused by Escherichia coli and other bacteria provides a reliable option for patients suffering from these uncomfortable and potentially serious conditions. The versatility of Cefixime extends to its use in treating Otitis Media, infections of the middle ear, which is a common ailment in children. The simplicity of its oral administration, coupled with its broad antibacterial spectrum, makes Cefixime a preferred choice for pediatric infections. Through these typical uses, Cefixime demonstrates its invaluable role in the management of bacterial infections, offering hope and healing to countless individuals. Advantages of using Cefixime. One of the most significant advantages of Cefixime lies in its broad-spectrum antibacterial activity. This characteristic allows it to effectively target a wide range of bacterial pathogens, making it an excellent first-line treatment for various infections. Its efficacy against both gram-positive and gram-negative bacteria ensures that clinicians have a potent tool in their fight against bacterial diseases. Another notable benefit of Cefixime is its oral bioavailability. Unlike some antibiotics that require intravenous administration, Cefixime can be taken orally, facilitating easier administration and compliance, especially in outpatient settings. This ease of use is particularly beneficial for children and patients who may have difficulty with intravenous treatments. Furthermore, Cefixime's long half-life allows for once or twice daily dosing, which is a considerable advantage in terms of patient compliance. The less frequent dosing schedule reduces the likelihood of missed doses, enhancing the effectiveness of the treatment regimen. These advantages underscore the importance of Cefixime in the therapeutic landscape, offering a combination of efficacy, convenience, and safety. Potential adverse reactions of Cefixime. Despite its numerous benefits, Cefixime, like all medications, comes with a risk of adverse reactions. These reactions can vary from mild to severe and are important considerations for both clinicians and patients. Common side effects include gastrointestinal disturbances such as diarrhea, nausea, and abdominal pain. These symptoms are generally mild and often resolve without the need for discontinuation of the therapy. Allergic reactions are also a potential risk with Cefixime, as with any antibiotic. Symptoms can range from skin rashes to more severe reactions like anaphylaxis, although such extreme responses are rare. Patients with a known history of allergy to cephalosporins or penicillins should exercise caution and consult their healthcare provider before taking Cefixime. In rare cases, Cefixime may lead to more serious side effects such as pseudomembranous colitis, a condition resulting from the overgrowth of Clostridium difficile in the colon. This highlights the importance of judicious use of antibiotics and the need for monitoring during treatment. Awareness of these potential adverse reactions is crucial for ensuring patient safety and the successful use of Cefixime in treating bacterial infections. Recommended dosage of Cefixime. Determining the appropriate dosage of Cefixime is essential for achieving optimal treatment outcomes while minimizing the risk of side effects. The recommended dosage varies depending on the type and severity of the infection, as well as the patient's age and renal function. For most adult patients with uncomplicated infections, the typical dosage ranges from 400 mg once daily to 200 mg twice daily. For children, the dosage is usually calculated based on body weight, emphasizing the importance of accuracy in dosing for this population. The standard pediatric dose for treating most infections is 8 mg per kilogram per day, which can be administered as a single dose or divided into 2 doses. In the case of more severe infections or those caused by less susceptible organisms, the dosage may be adjusted upward, highlighting the need for individualized treatment plans. It is imperative for patients to adhere to the prescribed dosage and duration of therapy to ensure the effectiveness of the treatment. Premature discontinuation or alteration of the dosage without consulting a healthcare provider can lead to treatment failure and the development of antibiotic resistance. Therefore, understanding and following the recommended dosage guidelines for Cefixime is crucial for both clinicians and patients. Risks associated with Cefixime. While Cefixime is a valuable antibiotic for treating a wide range of bacterial infections, there are certain risks associated with its use that warrant consideration. One of the primary concerns is the development of antibiotic resistance. The misuse or overuse of antibiotics like Cefixime can contribute to the emergence of resistant bacterial strains, undermining the efficacy of existing treatments and posing significant challenges to public health. Another risk involves the potential for cross-reactivity in patients with a known allergy to penicillin. Given the structural similarities between cephalosporins and penicillins, there is a risk of allergic reactions in sensitive individuals. Although the overall risk of cross-reactivity is low, it is a factor that healthcare providers must consider when prescribing Cefixime, especially in patients with a documented penicillin allergy. Additionally, the use of Cefixime, particularly at higher doses or for prolonged periods, may be associated with an increased risk of certain adverse effects, including renal toxicity and hematologic abnormalities. These potential risks highlight the importance of careful patient selection, dosing, and monitoring during treatment with Cefixime. By acknowledging and managing these risks, healthcare providers can maximize the therapeutic benefits of Cefixime while minimizing the potential for harm. Precautions when using Cefixime. To mitigate the risks associated with Cefixime and ensure its safe and effective use, several precautions must be observed. Prior to initiating therapy with Cefixime, a thorough medical history and allergy assessment are essential to identify any factors that may contraindicate its use. This includes a history of severe allergic reactions to cephalosporins or other beta-lactam antibiotics. Patients should be advised to complete the full course of therapy as prescribed, even if symptoms improve before the medication is finished. This is crucial to prevent the recurrence of infection and the development of resistance. Additionally, patients should be informed about the potential side effects of Cefixime and encouraged to report any adverse reactions to their healthcare provider promptly. Monitoring for signs of antibiotic-associated colitis is another important precaution. Patients experiencing severe diarrhea, abdominal pain, or blood in the stool should seek medical attention immediately. These symptoms could indicate a serious condition requiring prompt intervention. By adhering to these precautions, patients and healthcare providers can work together to ensure the successful use of Cefixime in treating bacterial infections. This collaborative approach is key to maximizing the benefits of the medication while safeguarding patient health. Alternatives to Cefixime. In instances where Cefixime may not be the most appropriate choice due to resistance, allergies, or other factors, several alternatives are available. Other third-generation cephalosporins, such as ceftriaxone and ceftazidime, offer similar broad-spectrum antibacterial activity and may be suitable substitutes in certain situations. Each of these alternatives has its own unique profile in terms of administration route, dosing, and spectrum of activity, allowing for tailored treatment options based on the specific needs of the patient. For patients with penicillin or cephalosporin allergies, macrolides like azithromycin or clarithromycin may provide effective alternatives. These antibiotics also cover a broad range of bacterial pathogens and are commonly used in the treatment of respiratory and soft tissue infections. However, the potential for resistance and differences in antibacterial spectrum must be considered when selecting an alternative to Cefixime. Fluoroquinolones, such as ciprofloxacin and levofloxacin, represent another class of antibiotics that can be used as alternatives in certain cases. These agents are particularly useful in the treatment of urinary tract infections and certain respiratory infections. However, their use must be judicious due to concerns over resistance and specific adverse effects. By carefully considering the individual patient's circumstances, including the nature of the infection, susceptibility patterns, and potential contraindications, healthcare providers can select the most appropriate alternative to Cefixime. This individualized approach is crucial for achieving optimal treatment outcomes while minimizing the risk of adverse effects and resistance. Conclusion. Cefixime stands as a testament to the advances made in antibiotic therapy, offering a potent option for treating a variety of bacterial infections. Its broad-spectrum activity, oral bioavailability, and favorable safety profile make it a valuable tool in the clinician's arsenal. However, the potential for adverse reactions, risks of resistance, and the need for precautions remind us of the importance of judicious antibiotic use. In cases where Cefixime is not suitable, a range of alternatives provides the flexibility needed to address the diverse needs of patients. Whether through the use of other cephalosporins, macrolides, or fluoroquinolones, effective treatment remains achievable. The journey through the world of Cefixime highlights the delicate balance between harnessing the power of antibiotics and preserving their efficacy for future generations. By understanding the typical uses, advantages, potential adverse reactions, recommended dosage, and risks associated with Cefixime, healthcare providers and patients can navigate the complexities of antibiotic therapy with confidence. In conclusion, as we continue to face the challenges posed by bacterial infections, Cefixime and its alternatives represent crucial components of our therapeutic toolkit. Through careful selection, dosing, and monitoring, we can maximize the benefits of these powerful